I'm Dr. Thomas Myers, and I specialize in interventional pain management. I am a trained anesthesiologist who then subsequently underwent a fellowship in interventional pain management. All the way back in medical school, I learned that the most frequent reason of patient visits a physician is related to pain. Around 1 in 3 Americans suffers from pain on a daily basis, and I felt like this is where I could have the biggest impact. Many doctors are focused on acute care. Somebody gets sick and goes to the doctor, wants to get better immediately. And then there's a lot of patients who are left with chronic pain after the fact. And I like to be the guy who's able to help them with regaining function, quality of life, improving their pain. My absolute favorite part about interventional pain management is the ability for a patient to come in pain that they've been dealing with day in and day out for whether it's weeks, months, or years, and to lay my hands on them, do a procedure, and them walk out maybe even the same day feeling better. I've had many patients say, they look at you almost mystified and say, I haven't felt that good in years, and that's what I enjoy the most. When a person tells me they just want to spend more time taking care of their grandkids and children and play with them and lift them, and they're able to do that, that's very satisfying for me. The reason I really enjoy working with the physicians at Paradigm and being part of the group here is that we're able to deliver care on the entire continuum. Pain management really consists on a continuum, all the way from extremely conservative treatments and physical therapy, holistic approaches, to medication management, to what I focus on, which is interventional pain procedures and management, all the way up to some patients needing a more advanced interventional technique or even a surgery. Here at Paradigm, we're able to deliver all parts of that care under one roof. We're able to discuss patient cases on a personal level with the other physicians in the group, and you just don't get that kind of care at a larger institution. We're able to pick up the cell phone and speak to each other about patients and really go over their care and see whether it's conservative treatment, interventional treatment, or perhaps surgical treatment that would suit them best. Interventional pain management is a field where we specialize in using minimally invasive procedures and techniques to help alleviate pain. This may involve an injection-based procedure, whether it's a joint injection, an epidural or spine injection, or a more advanced technique like an ablation procedure. These are minimally invasive techniques, typically delivered with a very small needle. I often tell my patients it's like an acupuncture needle, and they'll walk out with a Band-Aid at the end of the day. And these are techniques that have been shown to alleviate chronic pain. We're certainly also studied in the entire spectrum of pain management, so we know when to refer for conservative and physical therapy, when to use medications to best treat pain or improve other symptoms like depression or sleep difficulties that come right alongside chronic pain. But our focus is certainly on the interventional procedures. Certainly low back pain is by far the most common condition that we treat. I believe it's around 27 or 30% of all patients living in pain are suffering from low back pain. Patients may be frustrated because they're seeing their normal physician who's treating maybe their blood pressure or their diabetes, but not really focusing in on their back pain. They may not really understand why they're having back pain, and our job as interventional pain specialists is to tie it all together, take a history, do a physical exam, and then tie that in with the imaging they may have already done or that they need to really figure out what the root cause is. So low back pain can be from a number of things. It can be from the muscles, the tendons, the joints, the discs of the back, the vertebral bodies. There's a whole number of reasons why the low back can hurt. And our job is to tease out the reason why the low back hurts and then to treat that. So low back pain treatment options, starting conservatively, certainly a trial of physical therapy is always important. Oftentimes patients have already tried that when they present to us. Medication management, many patients know that they struggle with and have problems with medications or side effects, and so our treatment options really focus on things like epidural steroid injections and facet joint blocks and radiofrequency ablation procedures, which are really helpful for lower back pain, all the way up to advanced techniques such as spinal cord stimulators, which have really been proven to give longer lasting results, all the way up to intrathecal pump and drug delivery systems. Spinal cord stimulator is actually an implantable device and technology that delivers a small electrical current to the posterior column of the spinal cord. This oftentimes is kind of a scary concept for a patient, but the way I explain it to my patients in clinic is that unlike a surgical procedure, which tends to not be reversible, a spinal cord stimulator is a fully reversible procedure. It's a procedure that you're able to try before you commit to it. That trial procedure is really no more involved than placing an epidural like we would do for a laboring pregnant patient. What I tell my patients in clinic every day is, instead of placing a small tube that delivers medicine, we're placing a small tube that delivers electricity to the posterior column of the spinal cord. Nowadays, this electricity will provide a tingling and what we call a paresthesia sensation to the painful area. And the newest technologies deliver even no stimulation, and so no funny feeling to that area, and just provide pain relief. Of course, if the trial is not successful, we can not proceed with the permanent implant, but if it is, and approximately 80% of these trial procedures do go on to a successful implantation, the implantation procedure is no more than a 5-centimeter incision and a small device similar to a pacemaker that goes up here in a patient's chest, but we place this in the low back. This device, again, it's not altering the function and the structure of the spine. It's simply delivering an electrical current to the posterior column of the spinal cord, and this replaces the painful signal with more of a gentle tingling sensation. I really stress to patients that it's a simple procedure from our standpoint. If anything, it's easier for us to place these leads than we do for laboring women because we're using a live x-ray machine that we call fluoroscopy. And the procedure is typically done in an hour or less. Many patients who receive a spinal cord stimulator implant will have 50% or greater reduction of their pain. It's a non-narcotic, non-medication treatment. There is no medication, I always tell patients there's no medication going through the rest of your body and your organs. Many patients are able to reduce their opioid or narcotic drug consumption by half or greater. We've certainly had people taper all the way off of their pain medications after a procedure like this, which I know is many patients' main goal when they see a pain management specialist. Many patients are able to get back to the things they love to do. I certainly have lots of folks who hunt and fish who they just say that's all they want to get back to. They really struggle to carry their rifle through the woods or get out and play golf, and you're able to get back to those things that one loves to do.